My issue with this particular person, the PA, was that they did not take criticism well.
You white,
Yeah, his ears look infected. Hey everyone, so I am taking London to urgent care. He's had a fever and congestion and cough for the last 5 days now, and so I think he has an ear infection, but we're gonna go see another provider to make sure that that's what's going on. And I want to talk to you guys about like what to look for, especially in children in this time of the year, because it is cold and flu season. So when is it really dangerous? When do you need to take in your child to see a healthcare professional? And some of the things that we look out for as a doctor. So yeah. I'm so sad he's sick. It's a mess.
This mess, Mommy.
What mess?
That mess.
Oh, that's lots of plants up there.
Oh, that mess. That's mess.
All right, so we are waiting for urgent care to open, but Wyatt became kind of sicky last week, about on Wednesday. He had like stuffy nose, a mild low-grade fever, and so we tested him for COVID. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, ew, the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, oh, gross. Okay. Now we put it in here.
You boogers.
Yep, exactly, boogers. And it came back negative. And then the next day, or 2 days later, I think London started having the same symptoms, just like really runny nose and cough. And then at night he started developing like a low-grade fever as well. So right now it's like RSV season, and anyone in childcare or under the age of 2 has probably had RSV in the past. It's no big deal. You just need to constantly suction their nose because it's like so much mucus and drainage. It's hard for them to breathe. So things that you also look out for is if they're in any respiratory distress. So are they tracheal tugging, like, or are their ribs going in like this when they breathe? Are their noses flaring? Are they breathing really, really fast? You have a boot. Yes, you do. You want to take it off for now until it opens? Okay, I'll take off your boot. But yeah, you should definitely see a doctor if your child has had a fever for more than 4 days or 5 days, and a fever is considered over 100.4. We get concerned if fever is consistent over 5 days because it's other things that can be going on, like urinary tract infections or ear infections, pneumonia, or Kawasaki's, which is like inflammation of vessels and can infect the heart and things like that. But as you can see, like London is like still cheerful and happy. It's just like he continues to have this fever. Yeah?
Oh.
He is in his house.
Yeah.
I think a lot of people would ask like, oh, Jenny, if you know like what he has, like say if you know he has an ear infection, like can't you just prescribe him antibiotics? Isn't it easier than going into the urgent care and all that stuff? And I would say yes. Like if I was at a crunch, like if I was not able to, then yes, I can prescribe it for him, but it's unethical to treat your own family and write prescriptions for yourself. And it can also be very dangerous because then you have clouded judgment, especially when treating family, when treating loved ones and yourself. And so you might not see the whole picture as someone else who's looking at it from the outside. And so I don't want to miss anything. I'd rather have someone lay eyes on him. And so I don't ever really prescribe medications for myself or my family or my friends, unless they are like my patients, right? So some of my friends come to me and I'm their PCP, but other than that, like, oh, now we're waiting. It's 8:01. Let's go. Ready? Ooh. So, as suspected, London had an ear infection. So it says here amoxicillin 3 times a day for 10 days when the recommendation is 2 times a day. Oh God. I have issues here. So the provider that was seeing us at first was saying like, oh, you need amoxicillin, but you need it 3 times a day to treat an ear infection. And I said, no, it's twice a day that you need to treat an ear infection. And I pulled up UpToDate, which is like the holy grail of what we use for all doctors across all subspecialties. We reference UpToDate for treatment management, and it is amoxicillin twice a day, 90 milligrams per kilograms per day. And he's trying to give it to me 3 times a day, which is an extra dose. So instead of 10 mLs, I'm giving London 15 mLs. Like, there's no issue with giving him more medication besides the fact that he's getting more medication. There could be possible side effects from it. It's killing all his gut bacteria already. And so when I discussed this with this provider, I told them that, you know, like, this is what it says on UpToDate. And yet still, here, they gave it to me 3 times a day. And it's just frustrating. I feel like I shouldn't even put this out there because, you know, you want to be able to trust your provider. Oh my God, I'm so frustrated. Are you okay, London? You finally took some Tylenol? Oh yeah, what do you want to eat? Mommy get it for you.
Which rice?
You want rice?
No, which rice?
French fries?
Yeah.
Oh, we have tater tots. You want tater tots? It's the same thing as French fries.
Which rice?
Yeah, okay, let me mommy make it for you. Can we eat this one?
Yeah.
This person who saw me was a mid-level provider, so like a PA. And I'm not saying that all PAs are like this. I'm not saying that all NPs are like this. I'm just saying, like, this particular person in our circumstance, this is what happened.
It's done.
French fries not done yet, honey. We just gotta wait a little minute.
Rice.
You want a French fries?
Yes.
Okay.
Okay, that's a big plate. Really hot.
Yeah, blow it.
Hey, it's better.
It's better?
Yeah.
Hey. Might as well, since I'm venting already. What frustrated me even more about the situation was that once I challenged this person on like the dosing of the antibiotic and what is, you know, necessary versus unnecessary, they proceeded to say, well, you know, your child, we can just observe children and we don't need to actually treat ear infections if they're looking fine. And you know, you guys know that I'm very passionate about this, especially ear infections in little children, because Wyatt had an ear infection that we treated that never really resolved, and that's where his speech delay came from. He had to get ear tubes, and so, you know, it can really affect a child's development if these things are not treated. don't know if I said this or not already, so I'm going to say it again, but I have nothing against PAs or NPs working in urgent care or emergency medicine or anything like that, or even in family medicine. My issue with this particular person, the PA, was that they did not take criticism well, even though the science demonstrates that they were wrong. And so when I practice, I don't care who comes to me. I don't care if it's a doctor, like other specialists, or patients even. I learn from everybody. I learn from every different subspecialty. I listen with an open mind and we have a discussion. And I'll admit when I'm wrong and I'll agree to therapy that I think can possibly work, even though it's not my original plan. And so that is what's frustrating to me, because I don't think that this person will change their practice at all, even though the standard of care says differently. Like it's very upsetting to me. And so I don't know who signs off, what physician signs off on this person's paperwork. I don't know if they get further education. They literally specifically said, I haven't looked up otitis media treatment for quite some time. Then maybe you should look it up, because science continues to change. When we have new information, things continue to change. And so I am very frustrated in that aspect. And that's why I still think that further education, further training, residency is necessary for good patient care, and for, like, come on. Yeah, I don't know what you guys' opinions are. Am I overreacting? Am I just being tiger mom? Like, I don't feel bad specifically in my situation, because I know the standard of care. I can still give the treatment to my child, but I'm worried about like all the patients that are to come after. But yeah, okay, that really put a damper on my day. Anyways, let's make lunch. I have all these tomatoes from the garden that I need to use, and I saw this great TikTok where they made it and marinated so it tasted like tuna. I don't know. Excited to try this.
I made that one, Mommy.
Thank you.
Hey, nice. Oh, bit.
Good morning, everybody. So I am back. I am refreshed, feeling a lot better. Had a lot of great food, drank some wine, did my nails, and now having coffee. So I'm in a better mental health space. And I realized that yesterday I was just doing like a lot of complaining, and I want this to help you in some sort of way. Like, I know you guys feel me and feel my frustration about not getting the kind of care that you deserve as a patient. For me, my philosophy is that patient education is the most important thing for healthcare and preventative medicine and overall healthy well-being in general. And so when you don't get that, it is very, very disappointing, and I apologize on behalf of all healthcare workers. And I don't think it's any particular profession. I think there are not as great individuals in the healthcare field that they are letting us down. So what threw me off yesterday was that when I was asking this PA a question, they kind of just like blew me off, as in like, oh, that's a stupid question, along with the eye rolling. And then so I pressed further. Can you explain to me why this is a bad question? Or why are we not considering this? It was very uncomfortable for me because it's like the first time receiving it from the other end. And it was just confusing because a lot of people will not challenge that, and they're like, oh, this is a healthcare professional and they just made me feel really stupid. I'll just sit back and be quiet and then listen to them and later on decide if I want to take their recommendations or not. But what I urge you to do is, when you're in that situation, please voice your concern. Say that, hey, I don't really understand what you're saying. I don't understand why we are doing this treatment, and I have this concern, like this is what I read. Can you please educate me on this? Or what are your opinions on this? It's all about a discussion. They should not be talking at you. This is an education where there should be room for learning on both sides. I can't emphasize how important that is. If they are PA or NP working like in urgent care or the emergency room, ask for a doctor. Guarantee you there is going to be a doctor there, and it is within your right to ask if they are not educating you or explaining things to you properly. So when someone else comes, voice your concern again. This is what I'm concerned about. Why are we not doing this? Or explain to me what is going on because I don't understand. If they're another doctor and they're doing this, I highly recommend that this is not the doctor for you. You are not going to get good patient care, and so you can look elsewhere. It's within your right to request another provider. It is always within your right to ask for a second opinion, someone who is willing to advocate for you. So I'm very passionate about this, and I wish that I can be all your primary care providers. Like, that would just be so awesome, but I know like I can't do that because I live here in Washington and there's just so me to go around. So I hope that you guys find that perfect fit for you, someone who is going to be on your team, because that's all we need in medicine, like someone to be our advocate. All right, that is all. I hope you guys enjoyed this video. Cheers. Don't forget to subscribe and turn on that notification bell. Next week's video is all about weight loss and fertility with PCOS. If it's too long, I might split it into two, but you don't want to miss it. All right, leave your questions and your comments in the comment section below. I'll be sure to get to them. Until next time, peace.